framework. I was listening to Jara sir also, who was very much specific about explaining the things. So this part B will be carrying 100 marks, 100 weightage out of 1000. And as I told, there will be 7 criteria. Those will be carrying 900 marks. And this will be part B, which will be discipline specific, college specific. It will carry 100 weightage. Now, in that 100 weightage, we have total 16 metrics, remember, for Ayurveda. And you'll be happy to know that Ayurveda College in the health and discipline has got maximum metric in terms of, asking different aspects of Ayurveda related things. So it has around 11 qualitative metrics and 5 quantitative metrics, having 70 weightage to the qualitative metric and 30 weightage to the quantitative metric. So Ayurveda has maximum metric in this particular part B of revised assessment framework. So I'll directly get into the metric itself and we'll start discussing metrics. So first one is qualitative. Most of the metrics over here, they're qualitative in nature. Qualitative means, as I told in the morning also, like peer team will be having, a personal visit, physical visit to the college, and they'll be assessing these aspects. Even before that assessment, whatever documents, evidences, and data we submit with respect to qualitative thing, that will be assessed over there as well. So 8.1.1, which is having 5 weightage, asks us about the integration of various other systems, other healthcare systems in teaching hospital. Now, what is expected here, as an Ayurveda hospital, how do you integrate other practices in your teaching hospital for delivering the healthcare and exposing the students of Ayurveda to different practices? This is exclusive to the hospital, not in the teaching practices of the college. It is only a teaching for practices of hospital, how the patient care is rendered by integrating different allopathies. And how what is the policy of the institution? I mean, has the institution come up with a policy of integration of those practices into the teaching hospital? If there is any authority who is recognizing those things, whether a letter of approval or recognition has been obtained from the appropriate authority, and details of those integration in terms of how many departments have been come up of different practices, how many faculties or consultants or doctors that are involved in that particular integration, and clinical conditions, those are considered for integration, and integrated protocols, those are developed. So those detailed aspects will help you to give a write-up of 500 words here. And please focus only on integration of other practices into a teaching hospital. That will help you to claim those 5 marks. And if you have the integration of those practices with a proper policy, with the recognition from the appropriate authority, it will help you to claim those 5 marks. 8.1.2 is qualitative again. My request to all the participants to pardon me if I pronounce different specific words of Ayurveda wrongly, because I'm not used to it. They're very specific to your own pathy, and they're Sanskrit words, so I may pronounce it wrongly, but pardon me if I'm going wrong in somewhere. So this is qualitative again, asking about the institutional mechanism towards a classical way of Ayurveda learning. This is asking us about additional efforts over and above what is asked by the university, what is asked by the council. What additional efforts are taken by the institution to facilitate Sanskrit learning, spoken Sanskrit, as well as Sangeeta Patan, Nigantu, Rashala Grantha Patan, all those things. So what additional efforts have been made by an institution? Please do not limit what is asked there. You can have anything which is related, which helps in Ayurveda learning for the students. That can be included. It may be anything, not limited to what is asked for here. What is expected in this particular metric is the teaching schedule, including total hours of the teaching, the attendance and certificates of the completion of hours. If it is beyond the curriculum, you are having special efforts or taking special efforts, making additional efforts for those things. Attendance registers and course completion certificates and all those things will help. Then assessment if you are doing, and any feedback as well as outcome of that particular special program which is run by the college can be given as evidence over here to claim those 10 marks. And 10 marks are good, good number of marks over here in this particular qualitative matrix. 8.1.3 is asking about 2 important things. It is for 10 marks. You can equally divide those 10 marks into 2 equal parts. First is the seasonal Panchakarma, and this seasonal Panchakarma, they are asking about different efforts made by institution to promote the seasonal Panchakarma, including many aspects they were asked, like Vasantika Woman and Sharda Erection and all lifestyle modifications for the principles of Ayurveda. If you give a beautiful write-up and support those that write-up with the proper evidences, including various protocols, those are incorporating principles of Ayurveda and their implementation. Then various activities, those are conducted by the institution to promote the seasonal Panchakarma, and number of such sessions and procedures performed by the institution. So you may have to go back to the OPD records, try to get the data, and then try to compile the data. In that way, you'll be getting those 10 marks over here. Then if there are any protocols developed for lifestyle modification through Ayurveda and the promotional activities, those are undertaken. Number of patients who were advised those lifestyle modifications and the outcome in those patients. So the record thereof may be provided as an evidence to claim 5 marks in the season of Panchakarma. So in this 8.1.3, again they're asking about Kaumara Panchakarma, where we have to describe the details of the activities those are undertaken by the institution or this particular activity in 500 words. Same thing, what is asked in the earlier one has to be repeated here. Like we have to give the details of whatever activities they are conducted with regard to Kaumara Panchakarma. It may be towards maintenance of the quality, details of various training sessions, including their content, frequency of training, skill development programs for the therapies, any standard operating procedures if they are developed, their implementation, their monitoring, and the revision of the SOPs time to time whenever it is required. Then various activities, those are conducted towards improvement of the clinical documentation as the details of the new initiatives of administering Panchakarma procedures. Then details of mock drill to manage complications with respect to this particular Panchakarma that has to be given in terms of policy decisions as well as in terms of practices through SOPs. If that is given properly, that can be very good evidence to claim those 5 marks out of 10 in 8.1.3. 8.1.4 is again qualitative. It is asking us about the steps those are adopted by the institution towards implementation of Swasthya activities such as Saturutta, Acharya Rasayana, Dincharya, as well as Rutucharya. This data has to be for last 5 years, and we have to describe those activities. Those are undertaken by the institution in all those aspects, and various promotional measures undertaken for each activity in the community. I mean, how institution ensures that maximum patients or maximum people they adopt those practices or those undertake those treatments. That details have to be taken. It can be involvement of a specific department or institution as a whole in promotion of those activities. Then list of the patients who have undergone such activity and their outcomes in last 5 years have to be elaborated here. So whatever quantitative data you get in those qualitative metrics has to be generated and uploaded as an evidence. Try to limit the quantitative data in the qualitative metric elaboration. So you have to describe only the relevance of those activities, either the practices, the SOPs, and how do you actually promote those activities, the different measures undertaken by the institution. 8.1.5 is quantitative metrics, asking about the institution, how it has taken adequate measures to develop and maintain the herbal garden, which is an integrated component for the Ayurveda discipline. And it is asking, this is quantitative metric for 5 months, asking about the total area of land where the herbal garden has been developed, and we have to pick wherever it is applicable. There will be 4 options over there. Then total number of species of plants. So some statistics have to be provided over here. The name of the species, number of plants they are adopted in that particular herbal garden, and whatever is asked there, the plants they are about 500 or between 400 and 500. So you have to tick that and give the list of plants, including species name and everything there. So in that way, you'll be able to claim those 5 marks. If you have any data over and above that quantitative data, please upload that as additional information, relevant information. You can have a elaborate write up over there just to justify how you are taking adequate measures to develop and maintain herbal gardens. Whatever procedures you are adopting for the maintaining herbal garden, that can be uploaded as an evidence or as an additional practice to support that claim. Because we should not restrict in uploading the quantitative data. If we have any document related to that, it may be qualitative data that can be uploaded to claim that particular, to support that particular claim. So in that way, it will be easy to get those 5 marks. 8.1.6 is asking us about the institution. It has taken adequate measures for the preservation and propagation of the rare and endangered plants. Now, this data has to come from National Medicinal Plant Board. So NMPB gives the details about the rare and endangered plant. If institution, being Ayurveda institution, because you are involved in preparation of drugs and manufacturing of drugs from a plant-based material, so what additional efforts the institution takes? or what adequate measures the institution takes for the preservation as well as propagation of those things. Now, in this particular aspect, if you are really, having no data under the National Medicinal Plan Board, you can always go for IUCN. IUCN always you plans, those are rare, those are endangered, or those are vulnerable, and you can always take up some initiatives, come up with some initiatives for preservation and conservation of those plants. IUCN is International Union for Conservation of Nature and Natural Resources. So plants, medicinal plants, they come under natural resources. IUCN is an international organization, gives the list of, it publishes the red data book every year. So if you just follow the red data book, which has rare plants, endangered plants, vulnerable plant, and extinct plant, that will help you to identify which plants have to be propagated, which plants have to be preserved. Where the plants those are rare and endangered, they only need to be preserved. Other plants, they are available, they are not rare or endangered. There is no need to propagate or you preserve those plants as such, being a Ayurveda college. So you have to upload the details of activities those are undertaken by the college to promote the conservation as well as propagation of these rare and endangered plants. So they are specifically talking about rare and endangered plant. There is no mention about extinct plant as well as vulnerable plants, and that's why you can always focus on rare and endangered plant. You can always upload the geotag photographs of those facilities as well as the garden which you have developed. Next metric over here is quantitative metric, asking for the annual expenditure which is incurred towards herbal garden development as well as maintenance, including purchase of raw material as well as medicines during last 5 years. So year-wise data has to be given, and this expenditure, I repeat again, it has to be reflected into the statement of account, being a routine activity of the college, and it is mandatory as per the Apex Council. So this account, this data, this expenditure has to be reflected into the account statements. And what is expected here as an evidence is the CA or finance officer certified extract of expenditure. As I told, it will be very much difficult always to have same terms in the auditor statement as the NAAC asks, but you can always take out summary and ask CA or finance officer to put the signature, and that summary can be always produced as an evidence. Then details of land documents of the plantation area, they have to be uploaded. If you are claiming that is your herbal garden, if the land is on the name of college or related to parent trust of the college, then various activities those are undertaken by the institution for cultivation and propagation of medicinal plants. These will be additional evidences. Remember, when we are saying that we are spending so much of amount for the herbal garden development and maintenance, so what are activities are involved over there? But when we say development, it doesn't only mean the plantation. It doesn't only mean rearing the plants or watering them and all. Whatever things are associated with them, they all have to be given over there as a in support of the claim which you are making, and they'll be very well taken as evidence. So various activities and their reports have to be uploaded over here, geotag photographs, and again auditor statements. Most of the time, data it becomes very huge. DV partners will seek only few selective data for the DV verification process. They'll go for random check of the data, and it should be available with the distribution. And we have to host this data on an institutional website. Only give the link while uploading the SSR or filling the SSR. Only links. So DV will check the data from that link. So the data has to be available all the time until the DV process is completed. 8.1.8 is quantitative metric. It is seeking the information about the efforts by the institution to improve daily practices and promotion of such practices in the public as well as community. Society being one of the important stakeholders, the institution has got a responsibility to transmit the knowledge into society to make certain society. So they have asked us about 5 important things: whether there is a full-fledged yoga hall, whether there is a trained yoga demonstration, whether there is a facility for yoga for common public institution, or if there is any. Then if there is facility for the therapeutic yoga, which is again important thing which is coming up, facility for advanced yogic practices like Jalaniti as well as Sukhamiti. So if any of the facilities available, we have to give, you have to say yes. They're asking it for 5 marks, you have to say yes and give all the relevant documents. If any activities have been conducted under that particular thing, give the document report as well as document details to claim that's to support that particular claim, and yearly data of those people if the yoga demonstrations have been given or practice yoga classes have been conducted by the college. So those attendance as well as certificates and all those things have to be provided. that yoga demonstrator, again, qualified one. So in other metric, they are also asking about the certificate, that qualifications of yoga service provider. So those aspects have to be always taken care while compiling the data. Then next is the efforts of the institution towards conservation and validation of local health traditions during last 5 years. So what is important in Ayurveda is most of the things are already practiced by the community, since it is a tradition and it has come from the past generations. And even with the traditional healers, very specifically, in the tribal areas, even in the rural areas, there are traditional healers, although they are not recognized, but they are still practicing it, and people are getting cured from those traditional healing practices. So, being Ayurveda institution, where most of the things are related to Ayurveda, whether institution or college making some special efforts towards conservation and validation of local health traditions, including the traditional healers and all those aspects. So, does the institution has a list of all traditional healers? Those are available there. Has the institution tried any research study or any such training program for those traditional healers? Is there any type of the institution with the traditional healer or any such person involved in the healing practices? That is there. This you will be able to claim 10 marks in this particular metric, because this is asking us about the efforts of the institution towards conservation and validation. Validation in terms of, you can have a certificate program for the traditional healers where you can validate what they're doing. If you train them and those practices are being implemented by them or conducted in the community, you can validate what they are doing. You can call them, ask them what they are doing. If it is scientific, that is okay. If it is not scientific, train them, modify the practice, and accordingly ask them to implement that practice. But that is one area where most of the people are still approaching the traditional healers and getting cured. So that is one area where you have a huge opportunity to claim 10 marks. So detailed report of the events as well as geotag photographs have to be uploaded to support your claim in that particular metric. Number 10 is qualitative, asking us about the availability of licensed and certified teaching pharmacy for teaching and demonstration of students and medicine manufacturing. So this is one area which is very much relevant to Ayurveda drugs preparation and all. So if you have a blueprint of the pharmacy, list of all the equipment those are available in your college, then manufacture doses and forms. So if you are involved in manufacturing specific drugs and specific combinations, so come up with details of all those things. You can also mention how many how many such drugs you are preparing or manufacturing, and how much is manufacturing in the last 5 years. So all those things, come up with each and every detail. Whatever is asked, go back 5 years back, try to generate all the data and try to claim the entire thing over there. Then the GMP practices are also important. These are the manufacturing practices. Whether the college has got a license or certificate from the FDA, because FDA does recognize the GMP practices of Ayurveda colleges. So has the institution tried for getting GMP certificate from the FDA? That also you have to check. And if it is not there, please try to get it so that it will help you to claim all those marks there. So anything which is not there in the institution can be started straight away. I mean, there is no hesitation. There should not be any hesitation in the institution to start any practice right now, because it is never too late to start. So it is better to start and try to get into quality process. You will automatically come to know after a time span that quality assurance is taking place in the institution. 8.1.11 is quality. Again, 5 marks. As I told, we have maximum metrics in discipline specific part B in the Ayurveda. There are 16s and they are asking small things over there. For other disciplines, they are asking major things like medicine and dentistry. They are asking major things, and the major thing is major focus is on visibility of the institution in terms of how the students opt for taking admission based on the need percent and all those things. So it is not the thing with Ayurveda. It is more focused towards your own discipline and what things you are doing as a specialist. So it is asking about the describing various activities those are undertaken by the institution towards practice of various procedures which they are taught. You all know how you conduct that and what all activities you conduct. So try to elaborate. And as I told, do not ask any individual to perform those things in a solo manner. Try to have a team of experts or team of people, train them first. do not involve anyone who is not trained in this entire process. So train them first, spend some 2-3 days on the training. There are many trainings happening every day about the NAAC, about assessment and accreditation. Train them first, and then ask them to compile the data as well as do the write-up in this form. Otherwise, it will take this is not a routine activity. This is something special, and it is a continuous activity. So if you bring out some people, expert, by training them and give them some time, they will definitely come out with specific, write-up and specific evidences, and in that way, we'll be definitely achieving some good grades. So what is expected here is the detail of activities towards either maintenance of the quality or details of training, including content, frequency, at what, if it is happening at frequency interval, frequency of the training, skill development programs of those therapists, then SOPs. So everywhere SOPs are important, not only in this particular aspect, but everywhere SOPs are important, and the implementation, monitoring, as well as revision of SOPs, then activities towards improvement of clinical documentation, various details of new initiatives in administering the triacal procedures, and details of availability of emergency kits and mock drills carried out to manage complications. So this is, this is also asked earlier also, all those details with other Panchakarma, and the same has been repeated here with the Kriyakal. So documents, procedures everywhere remain same. Remember, I told you in the morning, how documents, it is a flow of data, flow of activity which happens in a pattern, and it is applicable to everywhere. So whenever you are involved in any such practice, a natural flow of data occurs, and the natural flow of documents occurs, evidences occurs. So that has to be maintained everywhere. 8.1.12 is asking about the activities undertaken by the institution towards practice of various types of Anushasan. I think this is some advanced things which are asked over here, beyond all routine surgical procedures and all. So we have to elaborate that in detail how various practices or how institution practices, how it initiate some measures towards practicing various types of Anushasan. Again, same thing are asked, whatever is asked for Panchakarma, details of the activities, the SOPs in terms of the development, implementation, and revision also. Then details of new initiatives, details of availability of emergency kits and mock drills carried out. So all those things will remain common. Whenever there is something related to healthcare delivery comes in future, so all those things will remain common. And please try to have all those documents. If it is not there, you must be doing all those activities, but you may not be having SOP. You may not be having revision of the SOP, you may not be having reports, may not be having frequent training. So try to have all those things which will help you to, get those 5 marks. 8.1.3 is qualitative metric, asking us for the description of activities undertaken by the institution for practicing various procedures related to Prasuti and Siro. Okay. It can include anything related to Prasuti and Siro. They have given two examples like Uttar Basti and Garva Sanskar. You can extend it to all practices you are following over there and describe those practices. How institution undertakes those activities and how various measures are initiated by the institution with regard to Prasuti and Siro Shastra. This is very specific. Again, you have to provide a web link to all similar documents which are asked for earlier, treatment procedures and all. So all same documents in terms of activities, in terms of trainings, in terms of SOPs, and details of new initiatives in administrating Uttar Basti and following the practice of Garva Sanskar and all. I mean, please do not limit it to only Uttar Basti and Garva Sanskar. Extend it to all practices you are following with regard to Prasuti and Siro. 8.1.14 is qualitative, asking us to discuss the facilities available in the institution towards delivering Pathya Kalpana. Okay, so this is again one thing where you are one who knows about all those things. So please describe in a proper way and give details of various facilities those are available for this Pathya Kalpana. Then training and skill development activities to improve the quality of human resources working in the particular sector. Documents of SOPs for Pathya preparations, facilities for instant preparation like Kalk and many other things, maintenance of hygiene of raw material storage and finished products. So all those things with regard to Pathya Kalpana have to be generated and a good write-up. Whatever is asked here has to be uploaded. But before that, we have to have a good write-up just to say that we are doing that thing and we have to claim those marks in the particular metric. Next is qualitative. The efforts made by the institution for carrying out pharmacovigilance activities related to Ayurvedic drug. This is applicable to all parties. This particular metric is applicable to all parties. With regard to Ayurveda, it is asking only about pharmacovigilance in Ayurvedic drugs. Okay, so we have to describe how do we carry out that pharmacovigilance. What are our activities? How do we ensure? And how do we report adverse drug reactions? What are the SOPs? And who is to be reported and all those things. Okay, so URI-wise data for reporting adverse drug reactions have to be given. Certificates of supporting the recognition in this regard by the national body is have to be produced over here. And various documents related to establishment of pharmacovigilance center, including different minutes those are conducted, their minutes and decision taken, action taken, and so on. So all those things have to be properly written in order to claim those marks. So this is 8.1.16, the last one. Again, it is common for all parties. They are asking about the accreditation of teaching hospital and clinical laboratory by the National Accrediting Agency. So it is NABH and NABL for hospital and laboratory respectively. ISO also, if you are not yet adopted ISO, please go for ISO. That is one quality assurance they are asking. And any other recognized accreditation or certification. So if there is any other, like Quality Council of India and any other accreditation body, if you are having any accreditation in that aspect, that can be claimed under number 4 of 8.1.16. And only private accreditation certificate agencies will only do if you are accrediting your institution right now and claiming it retrospectively, it will be difficult because it will be a valid document and accreditation cannot be done retrospectively. So if you are not done it, please start right now and then you can claim those marks even if it is for 1 year in the assessment period. That is also okay. But it is very difficult to get accreditation retrospectively and all those things. Okay. So that is it with 8.1.16. And we are done with part B, 100 marks. More weightages for quality 2 being an Ayurveda discipline. Most of the things will be inside, typically in the institution. And there are very less weightages for quantity to metric to be left to the review partner for their verification. Thank you.
Thank you, Tirme sir. I request participants to be stay muted. We have Dr. Y.M. Jairaj sir. He had rejoined the session, and I request Dr. Jairaj. We will have question hour session after